Hello and welcome to another episode of a podcast. This is a conversation looking at the failure of the war on drugs and to question some perspectives, some points of views that society currently holds on drug abusers and drug policy. Today, I'm joined by Ben, a Tedx speaker and a PhD student in harm reduction policy. Ben, thanks for joining me tonight.
Yeah, no, thanks a lot, Sam. Thanks a lot for having me. Really looking forward to our chat.
Ben, what was your motivation to dedicate so many years into researching harm reduction and the overall failure of the war on drugs?
Yeah, definitely. So you might not be able to hear it because of the English accent, but I grew up in Vancouver in Canada. I spent my teenage years there, and then following a short stint at university in the UK, I went back to Canada for a number of years. And yeah, for listeners who don't know, Vancouver's drug scene, open drug scene, is one of the worst in North America in terms of drug-related deaths, homelessness, and these sorts of things. And so, yeah, just growing up there and kind of being exposed to that sort of thing, it really just got me kind of interested in what are some of the reasons behind it. How can a country that's so wealthy and well respected on the global stage, like Canada, have such bad drug-related problems and deaths and these sorts of things? And so, yeah, I went to university and studied anthropology and philosophy. And for my undergrad dissertation, I looked at kind of media narratives in Vancouver and how these influenced policy around drugs. And yeah, then moved on to doing a master's where I looked more specifically at harm reduction. The focus there was on overdose prevention centers, which I'm sure we'll talk about in depth later on. But OPCs and how police kind of interacted with people who access those sites. And yeah, then I worked actually in the homelessness sector for a number of years, in shelters and in outreach and housing first. And yeah, now I'm kind of halfway through my PhD at Oxford, doing a global comparison, looking at harm reduction initiatives in Canada, the UK, and Greece. And so looking at how governments approach harm reduction, what is the philosophies that they employ, and yeah, what are the consequences and kind of benefits of having more of a harm reduction approach to drug policy.
Yeah, it's a very noble cause you're dedicating yourself to. It's very brave because I'm sure we'll discuss this later, but I think us as a society, we hold such an archaic view when it comes to how we view drug abusers and our current drug policy. In 1971, Nixon launched the war on drugs. Since then, it's cost the taxpayers on average $100 billion per year. It produces estimated gang revenue of $320 billion a year. And globally, 1 in 5 people are in prison for drug-related incidences. What have been some of the biggest failures of the war on drugs in the last 50 years?
Yeah, definitely. So I think the first thing to look at is what is the aim of the war on drugs? Having such high levels of enforcement, what is the objective here? So the objective here is to have a drug-free society. It's to have a society in which no one uses drugs and in turn have no drug-related harms. That's kind of the main philosophy behind it. And if you look at what's happened over time since Nixon famously came out with the kind of the war on drugs approach, none of those objectives have been achieved. So today, more people use drugs than ever in history. We have more drug-related deaths than ever in history. The criminal drug trade is bigger than it's ever been, and there's not really kind of an end in sight here in terms of reducing all of these harms. And so I think a lot of people in the policy world, in academia, activists, but also people who use drugs on the ground are now really calling for a change in approach, looking at kind of more novel alternatives like decriminalization and the regulation of drugs and these sorts of things. But yeah, just purely from kind of the cost of life, the number of people who have died from prohibitionist drug policies is really, really staggering. And if you look at kind of the reasons behind that, there's a really interesting concept called the iron law of prohibition, which I'm not sure if listeners have heard of this, but it's basically it's a very well proven concept where the more you try and restrict the global drug trade, the more potent drugs become. And so yeah, that's another thing that we can talk about moving forward. But I find that fascinating, and yeah, it's just really crazy to me how, despite all of this kind of data and knowledge that is out in the public sphere, governments are still refusing to change their approach.
Yeah, the crazy thing with prohibition is there's always going to be demand for drugs, whether we like it or not, and whether you think it's a good thing or a bad thing. But the current way we set it up is it's gangs who supply drugs, and it's not, drugs aren't being produced in safe pharmaceutical environments. What do you say of the main failures of prohibition?
Yeah, definitely. So that's also another one of the big lies about prohibition, is that we can get to a society where no one uses drugs, and that's just completely ridiculous. Throughout human society, throughout the ages, people have always used drugs. I mean, there's really interesting research that dates back to thousands of years, where you can see that kind of early humans were using kind of psychedelic plants and these sorts of things. So people have always used drugs, and even so, people will always use drugs. I think it's just kind of even ingrained into our human nature, and wanting to kind of experience kind of a different level of cognition, these sorts of things. And yeah, just trying to restrict that has really just caused a lot more harm than good. And even looking at kind of the arbitrary regulation of drugs, how it's not done based on harm, it's done really based on kind of the problematic racial history of how these drugs became enforced. If drugs were regulated now based on harm, alcohol and tobacco would be the first ones to get regulated. So it's just really backwards.
What is the racial history that exists with drug prohibition?
Yeah, definitely. So actually, the prohibition of drugs is a fairly recent phenomenon. It was only in the kind of the late 1800s that in North America there started to be a ban on opium, because it was Chinese migrant workers who came over from Asia to help build the railways, these sorts of things. And opium was their drug of choice. Alcohol was kind of the drug of choice of kind of the white populations there, and so they put a ban on opium. And immediately what that did is it created a heroin market. And even now today, we can see that the ban of heroin has kind of produced more kind of synthetic opioids, which are even more dangerous. But that's just one example. I think then you can carry on into the early 1900s, when there started to be bans on marijuana in the southern US, because that's what Mexican migrants were using. But the most famous kind of racial motivation for drug prohibition was around crack cocaine and powdered cocaine. So kind of at the time, 70s and 80s, when Nixon came into power, crack cocaine and powdered cocaine were being used pretty much at the same levels. But the thing is that powdered cocaine was being used by kind of the white middle class in the US, and crack cocaine was being used by Black and Hispanic communities. And so we can see literally in the legislation, in the law that was passed at the time, there was a 1 to 100 discrepancy in the prison sentence times for trafficking. So you would get 5 years in prison for trafficking 5 grams of crack cocaine versus 5 years in prison for 500 grams of powdered cocaine. And so the consequences of that were huge in terms of filling up the prison populations in the US. And yeah, no, just really interesting. You kind of all of these different drugs that have been banned. Sorry, again, you can look at psilocybin, mushrooms, and these sorts of things. Acid, MDMA, that was associated with more of the kind of the hippie community during the time of the Vietnam War, who were pushing back against government policy around then. So they said, we can't just go out and arrest hippies. We need something that will actually target them. And so people at the time in those communities were using psychedelics and drugs. And so it was a tool as a way of kind of getting to these communities in a legitimized kind of way.
Yes, it's crazy. I'm sure we'll get onto psychedelics and psilocybin a bit later on. But I was reading there's even just subtle differences, subtle forms of racism that has been inserted into the war of drugs. For example, I think in the 1930s, during the Great Depression, the Americans, they started to blame the Mexicans. It was the Mexican migrants who, you know, contributed to the Great Depression. And they started calling cannabis marijuana instead of cannabis. We use the Spanish word instead of the English word because we like to alienate it and, you know, I guess create this image in our head that it's a terrible thing. What are the implications of treating drug abusers as criminals versus patients?
Yeah, definitely. So I think there's a few different arguments you can make here about how kind of at a policy level we respond to drug use and problematic drug use. I think the first thing is that people who use drugs, arresting someone for using drugs, firstly, that's a non-violent crime.
Yeah,
that's a crime where someone's not going out and harming someone else in society. So just kind of at the baseline level there, does someone deserve to have their freedom taken away for something that they aren't imposing on someone else? I think that's just a very basic question. The second is looking at the kind of the causes of drug dependency. There's a really interesting author, Gabor Mate. I'm not sure if you've heard of him. He was based in Canada, and he basically did a study that found that around 2/3 of people who were dependent on heroin had suffered significant childhood trauma between the ages of 0 and 4. And so there's an argument that if it's the state's responsibility to intervene and protect children at these ages, and the government isn't doing a good enough job of that, and then later on in life, people are becoming dependent on drugs, should it then be the government's responsibility to treat them in a non-judgmental, public health-centered way? And I really think that to be the case. And then the third one as well is like the hypocrisy around kind of alcohol and tobacco. Yeah. All of the messaging around alcohol, tobacco, if you're dependent, is public health centered. How can we reduce the harms of this? How can we support people into reducing their alcohol and tobacco consumption? Whereas when you flip it and look at drugs that are illicit, pretty much all that's offered is a criminal justice route. And I mean, that's seen also from the policy level. Since 2010, kind of government budgets towards community treatment and diversion have been slashed by 40%, whereas money towards enforcement has been rising year on year. So we can really see that just from a policy approach, we're moving further and further away from kind of a public health kind of medicalized response towards the kind of the easy quote unquote criminal justice response, where the government can say, look, we are acting on this, when in actual fact all they're doing is acting on the consequences of poverty, childhood trauma, lack of education, all of these other problems which are really the kind of the foundation of problematic drug use.
Yeah, you've hit the nail on the head. I think a good example is like Detroit, the Rust Belt states in the US. Their local economy has been absolutely devastated by globalization and jobs being exported, especially out to China. And then subsequently, the amount of drug usage has substantially increased in these cities. And now politicians say it's drugs that have ruined these cities. That's the easy route. That's the easy route out. The hard route out is actually to examine the fundamental issues that have gone wrong and to invest money and resources into these areas and actually question, okay, why are people turning to drugs? Do you think politicians have it in them to have that compassion?
I think politicians do have it in them to have that sort of compassion if it supported their kind of political narratives and their political objectives. And the problem with kind of the discussions around drug policy is that it's not a vote winner. It's actually the complete opposite. It wins votes for politicians when they can say, we're being tough on crime, we are tackling the source of all of these problems in society, when in actual fact it's just a lie. And tackling drug use and weaponizing drug policy is actually just a way to to cover their track. I mean, you put it perfectly. It's a way for them to not address the fundamental issues in society that would need significant investment, like education and poverty and kind of the expansion of the welfare state. All of these things, increasing levels of kind of access to care. All of these things that would reduce rates of addiction. Instead of doing all those things, you can say we're being tough on drugs and we're arresting people, and yeah, which is it's just a lie, really. It's a massive lie.
It's really interesting because whenever politicians lie, especially here in the UK, for media, we jump on their back instantly. Like, look what happened during the pandemic. Why has the weaponization of the war on drugs not been heavily scrutinized? This is a failed policy for 50 years. There's no other area on earth where you'd have a failed policy for 50 years and people wouldn't question it. Why is that the case?
Yeah, I think the most important thing here is that the conversation around drug policy, throughout, although it's been failed policy over the past 50 years, what it's really done a good job of is dehumanizing people who use drugs. Right. And so whilst these policies have failed, they've massively succeeded in increasing stigma against people who use drugs and alienating them, which actually then backs up the policies that the government is looking to enforce. So it's not by chance that kind of in the media and in movies and in kind of public outlets where we hear about drug use, it's always kind of a homeless person using drugs, or people, someone who's using drugs who's devastating their families, or doing all of it. There's always a very, very negative kind of portrayal of the drug users being this person who's addicted and living in squalor and all of these things, when in actual fact, the majority of drug use is non-problematic in society. I think it's something like 97% of drug use in society is non-problematic. It's people who are able to manage their drug use, whether that's recreationally, at the university, or partying, or these sorts of things, or whether they're self-medicating in a controlled way. The only thing that we get told kind of in the media and by the government is that you'll try drugs and you'll be addicted straight away. Yeah. And so kind of, I think there's a number of lies that around kind of the drug policy narrative that we get fed from a very, very young age. And I mean, you can't really blame kind of parents and teachers for this, because the government is weaponizing fear. Obviously, no parent or no teacher wants their child to then go on to be dependent on a substance. But the reality of it is that for the majority of people who try drugs, that is not the outcome. But our policies are geared towards making us think in that way.
Yeah, it's interesting you mentioned teachers there. I remember when I was 14 years old, I was in an RE, like a philosophy lesson, and we were talking about drugs. And the teacher asked of the class, what should happen to drug abusers? Should they be sent to rehabilitation, or should they be sent to prison? And 90% of the class put their hands up and said they should go to prison. They're committing a crime. They're criminals. And I think that's the seed of our current attitudes towards drugs, towards drug policy, because we get fed this rhetoric from such an early age. Do you think that could be broken?
100%. So, I mean, the destigmatization of people who use drugs is a very, very well researched area of drug policy. And I've actually got a paper coming out next month with some colleagues at Simon Fraser University in Vancouver, where we discuss how kind of the number one thing that needs to happen to destigmatize people who use drugs is decriminalization. Because when you have it at the legal level, at the highest level of society, when you say that people who use drugs deserve to be punished in this very, very simplistic way, without acknowledging the complexities of why people may start using drugs, and actually how it isn't just a harmful thing, the governments are propagating this narrative around drug users, which is then kind of seeped into society. And so I really think decriminalization at the base level will really help reduce the stigma over time. And I mean, there's really, really interesting examples of this. In Canada over the past kind of 10, 15 years, as attitudes towards kind of political attitudes towards kind of cannabis regulation have become more liberal, I mean, ultimately leading up to the complete decriminalization of cannabis. Now, public perceptions of people who use cannabis are completely different to what they would have been 15 years ago.
Right.
I mean, now you see middle-class, middle-aged people using cannabis, talking about it openly, and it's not a taboo thing. It's literally considered the same as having a glass of wine at the end of a long week. So I really think kind of destigmatization has to come through policy and regulation.
Do you think we could get to a point in the UK? We're such a conservative society where cannabis can be smoked on a social occasion and be socially accepted in the same way as having a glass of red wine.
Yeah, I mean, it's really tough, because if you'd asked me this 5-6 years ago, I would have said 100%. But I think recently with Brexit, kind of the political debate has become so polarized that I can't really see that happening anytime soon. But again, if you look at the harms of smoking cannabis compared to binge drinking, which is the number one most preferred thing for most Brits on a Friday or Saturday night. If you look at the harms of binge drinking, both to the person's body, but also the social harms of kind of damage to property, fights, people going to A&E on a Friday, Saturday night, all of these things, that just doesn't happen with cannabis. I mean, you look at places like Amsterdam, Vancouver, these places where cannabis is fully legal and you've got coffee shops, and kind of rates of smoking are so high. I mean, not just smoking, but other forms of using cannabis. To me, having grown up there, it just seems like a real no-brainer. And yeah, I really, really hope that we can get to that place. I mean, I was hoping that our discussion could shift towards harm reduction. I'm sure you're going to take it that way. But even just as a form of harm reduction, kind of increasing cannabis use has been proven to reduce alcohol use. I mean, that this was proven in Oregon, and I think in one other state in the US that has recently decriminalized. But since there's become a regulated market for cannabis, rates of alcohol use have gone down, rates of drink driving have gone down, and that's just because people are choosing a different drug of choice. I mean, instead of getting absolutely blackout drunk and being completely out of control, people have an option that is still socially accepted, but just isn't as destructive. So I think that's really the way forward.
Yeah, absolutely. So decriminalization is one part of the equation. The second part of the equation is what you just touched on, it's harm reduction. What is harm reduction for people who don't know?
Yeah, definitely. So harm reduction is the primary focus of my research, my PhD research, and it's basically the idea that accepting that harm takes place in society, that people do risky things in society, and like there are things that we do, like driving cars, which is risky. So what do? We put seatbelts in place. There's things in society that are risky and that are harmful, and so policy, but also specific programs should be implemented that reduce the harms associated with that specific behavior. And so it's, for example, acknowledging that, like I just said, people drive and that's dangerous. We've regulated seatbelts, so everyone has to wear seatbelts. Acknowledging that people are gonna sunbathe in the summer and that can cause cancer. What do? We provide sunscreen. All these kind of real life examples that use harm reduction approaches that are completely accepted, and you can transfer these towards drug policy as well. So one of a really, really famous one are needle and syringe exchanges. So during the HIV epidemic that started in the 80s, kind of research was coming out showing that actually this is primarily being caused by people sharing needles, and bloodborne infection being transmitted that way. So what do? We provide as many needles as people need. They don't have to share. That reduces the transmission 100%. There's other interventions like the distribution of naloxone. So naloxone is the antidote to an opioid overdose. So it's basically in Canada and other parts of the world, they're doing this now, where they're saying we're just going to flood communities with naloxone, so that if someone is overdosing, there'll be naloxone, people can use it and save them. Arguably the most effective form of harm reduction that has ever existed, which is what I study, are interventions called overdose prevention centers. They're also called, I mean, in North America, they're called drug supervised consumption sites. In Europe, it's drug consumption rooms. But effectively, these are facilities where people can bring their drugs in off the street, and they can inject or smoke in front of a healthcare professional. So in front of a nurse or a harm reduction worker who's trained in reversing overdoses and for giving injecting advice or smoking advice. And so in places like the downtown east side of Vancouver, where you've got such a concentration of drug-related deaths because of heroin use and fentanyl use and these sorts of things, you can completely mitigate the chance of dying when you've got someone there to administer naloxone. And so there's over 200 OPCs that exist in 14, 15 countries around the world. And yeah, kind of the results of these facilities have really been amazing. And yeah, my research is looking at implementing them in the UK. So yeah.
Which has been the most successful example?
I mean, it's really difficult to say most successful example, because wherever they have been implemented, they have been successful. No one has ever died in an overdose prevention center worldwide. Wherever you put it in Vancouver or San Francisco, where they've got some of the highest drug-related deaths in the world, no one dies. Or you put them in communities in France or kind of Barcelona, for example, in Spain, where there's slightly less drug-related death, still the outcomes are amazing. And so basically the point of this intervention is people will come in, and normally the OPC is embedded within kind of like a community health center. So there'll be a GP there, there'll be housing workers, you could have legal professionals, you have these wraparound auxiliary services. And so the aim is to help engage people who would typically never seek help. So these are majority people who are on the streets, who are homeless, who would never go to their GP, who would never kind of go to get housing advice, for example. But because you're engaging them through their drug use in a non-judgmental, purely public health-centered way, they then have the opportunity to speak with all these other services. And so evaluations that have been done on these services have been really incredible, showing that when people go in to use drugs, over a 3-month period, their chance of actually going and accessing detox services or housing services drastically increases. And I mean, the cost saving as well, there's been numerous studies from Vancouver, Sydney, Switzerland, Portugal, that have all shown that municipalities can save a huge amount of money. I mean, there's massive drops in kind of ambulance call outs, massive drops in drug-related death, which takes up a lot of kind of money of the taxpayer and these sorts of things. So both from a public health perspective, but also from the more kind of conservative cost-saving side, it's a win-win across the board, really.
That's fantastic. Which is this a trend that is, I guess, starting to pop up just in the West, or are there other countries, other regions of the world, which are considering these harm reduction, these needle exchange programs?
Yeah, I mean, so there's a brilliant organization called Harm Reduction International, and every year they publish a big report called the Global State of Harm Reduction, and it basically tracks data from every country, looking at kind of what policies they're implementing, what interventions are they putting in place with harm reduction focuses, how is their legal system changing to account for harm reduction services. And what they showed this year is actually in non-Western countries, harm reduction interventions are increasing. So in many African countries now, needle and syringe exchanges are becoming more developed. In Southern American countries as well, it's increasing. But I'd actually say the overdose prevention centers, where you have these medical facilities where people can go in, for now that's kind of restricted to Europe, North America, and Australia. But I think over time, it's on the rise. It's on the rise, really.
I think a big barrier to this is just optically, some people will just assume that you're facilitating drug use, but you're almost encouraging it in a way, and that potential drug use across society might increase as a result of normalizing it and creating safe spaces. What do you say to that point of view?
Yeah, definitely. So I don't think that overdose prevention centers are necessarily normalizing like normalizing crack use or heroin use. I don't think because there's an overdose prevention center in a community, people who have never tried drugs will then go and say, oh, this is perfect. I can pop down to my local overdose prevention center and start using these really, really potent drugs. I think actually it's the complete opposite. What it's doing is it's engaging with typically street-based drug users, people who would normally be using drugs in alleyways, or in really isolated places, and is engaging them with healthcare services. And I mean, all the evaluations that have been done, like I said, prove that they help people access healthcare and access other things that will kind of improve their lives. And yeah, I think that harm reduction is just, it's showing people in the community that kind of we care about the health of people who use drugs, regardless of the fact that they use drugs. And so I think that when we were talking earlier about what are things that can help destigmatize the issue of drug policy, implementing these sorts of approaches, I think will also work towards that for sure.
Ben, talk to me about some of your PhD research specifically into this.
Yeah, definitely. So like I said, for my master's research, I was looking at overdose prevention centers in Vancouver. And so for this, I spent 6 months in an overdose prevention center there, kind of day in, day out, looking at how people interacted with the service, and importantly, how police interacted with people who access that service. And so the idea for my PhD research was to expand this out, looking at 3 countries, all which are at different stages of drug policy development, different stages of harm reduction development. And so the first place that we looked at with my supervisors was Sandwell, which is just outside of Birmingham. And so Sandwell, Birmingham, the UK, there's no overdose prevention centers, and needle and syringe exchanges, the coverage is pretty limited. So I'd say it's approximately 20 years behind where Vancouver is. So in terms of looking at that, we were looking at Birmingham, and we were looking at Vancouver, which is 20 years ahead. And then I'm also looking at Athens, Greece, which is just implemented an overdose prevention center. So they would be right in the middle there. So the goal here was to look at 3 different case studies, all at different stages of drug policy development, and speak with drug users in those communities to talk about their experiences in accessing services and how their lives have changed in Athens, where they've had it for 6 months, and Vancouver, where they've had it for 20 years, and then comparing that to the experiences of often street-based drug users, people who are homeless, injecting heroin and smoking crack on the street of Birmingham, and talking to them about overdose prevention centers and what they thought of this intervention, and how they thought they could benefit from it. And so kind of the methodology that we used was also quite unusual. We wanted this to be kind of a collaborative study. So in Birmingham, we were working with street-based drug users as co-researchers, as peer researchers. So they helped out with the research. And what we did there was we paid them, I think it was about £50 for 3 hours of work. And as researchers, we were then led into the community by homeless drug users so that we could be introduced to people who are using drugs in these really isolated locations. So they would take us down to canals, into abandoned buildings, into the toilets of McDonald's, basically to all these places where people currently in the UK who don't have access to these services are having to use drugs so to stay out of the way of the public, out of the weather, these sorts of things. And so we interviewed them, we did focus groups with them, and the data that came out of that was really, really shocking. Just people's experiences of kind of the shame of not having anywhere safe to go and use, people talking about the injuries that they had from having to rush their injections, kind of the wounds that we saw. And so all of these things that came up, we then had the chance to present in Parliament. So in mid-June, myself and Dr. Gillian Shorter from the University of Belfast and Professor Alex Stevens from the University of Kent, we were invited to present this research back to MPs and talk to them about overdose prevention centres as a upfront low cost over a long-term cost-saving intervention, that is clearly needed right now. And we were showing pictures and we were showing kind of these testimonies. And then we also filmed videos of these people who we interviewed talking about their experiences, talking to MPs, and we showed that on the big screen to MPs. And I think it did hit home. I think it was pretty shocking for them to see what's going on in their constituencies.
What was the feedback from the MPs?
Yeah, so I mean, when you talk to people on a kind of face-to-face level after that, they all said, wow, this is pretty shocking. This is really interesting research, and it's definitely something that we should consider. But kind of the output of that session was a one-page letter that was written by the UK Faculty of Public Health, that had been signed by over 500 leading academics, think tanks, policymakers in the UK, that was then presented to the Home Office, to Priti Patel, which laid out in one page the exact line of legislation that needed to be changed in order for us to be able to pilot these interventions. And yeah, we never heard back. So it's not very surprising that with the conservative government we have at the moment, these aren't being considered. But I mean, our goal now is to build up an evidence base here in the UK that can really shine light on the need, and then bringing in international examples to kind of back up the utility of these services.
Oh, that's so annoying. I read an article the other day. I think back in 2020, the Home Office brushed off harm reduction policies as an inconvenience, as something that is just getting in the way in the war on drugs. So is this something, do you think, perhaps the Labour Party or some other political parties would exercise, even consider?
Yeah, I mean, again, like I was saying earlier, harm reduction and kind of drug policy reform, it's not a vote winner. And kind of conveying these quite complex ideas in terms of reducing harm, and it takes a bit of time for a member of the general public who knows nothing about drug policy to come to terms with the things that we're discussing here. And so I don't think that, I mean, at least from what Keir Starmer's shown in the past year, he's also been brushing off harm reduction as a kind of legitimate approach. So I think just the fact that it's so hard to win votes on this topic, I think it's unlikely. I mean, the one positive is that Professor Dame Carroll's Black Review, which came out last year, that she was commissioned to do a big independent review of the whole UK drug kind of approach to drugs, and she did mention harm reduction there as being a key tool within the wider kind of approach. And as a result, she was able to get an extra 880 million investment towards, but it was toward drug services and drug treatment, which is quite different to harm reduction. But from what I've heard from people kind of that work in policy, that was kind of just the messaging that was needed to get this kind of funding across the line. And hopefully in the next few years, some of that money can be allocated towards harm reduction interventions, which are proven to help get people into treatment, even if it isn't necessarily considered as direct drug treatment. I mean, even though it's kind of reducing harms across a number of different areas, reducing infection and death, all these things, hopefully that money can be apportioned to that.
In the face of so much evidence, why is there such a stark difference between the attitudes of Swiss politicians versus British politicians? If we're all exposed to the same evidence, you have these global studies happening all the time with overwhelming evidence. What's holding us back?
Yeah, I mean, I think that's a really brilliant question, and one that I don't think that I fully have the answer to. I think that, like, as a country, I think we're inherently more conservative than European countries, both politically, kind of, but also socially, in the way that we look at kind of our social values. And I also think that as a country, I think the UK is much more closely tied politically to the US than our European neighbors are. So I think that The UK, if the US enacts a policy, the UK normally follows pretty quickly behind it. And I think that could potentially be in our favor now, because in New York, they've just opened 2 overdose prevention centers for the first time. The US now has 2 overdose prevention centers, so maybe that will kind of help shift the UK's thinking around it. But to be honest, I think we're just an inherently more conservative society, and I think it's a real shame, I think.
Yeah, it's interesting, though, because you mentioned the US. The US is going through this process where state by state, they're almost falling like dominoes, where the states are decriminalizing cannabis. Do you think that'll hopefully spill over in the UK in like 10, 20, 30 years time?
Yeah, I mean, again, all the evidence is there in terms of reducing harms to society, so I'm kind of using cannabis as a harm reduction measure, but also in terms of the tax revenue that we could get. I mean, I think it was there's a think tank called the Poverty Action Group, and a year or 2 ago they came out saying that the UK government could get a £9 billion cash injection each year just from having a regulated cannabis market. So that's just on tax revenue. That's not looking at kind of the healthcare cost savings we could have. So I don't know. There's always this hope that even though we've got a conservative government and kind of conservative leading ideologies, they will appreciate kind of the money that could be involved with regulating drugs. I mean, personally, I don't think that should be the number one reason for them doing it, because there's all of these kind of more moral, kind of ethical health benefits that are proven to have worked in other countries, and kind of the money that could come out of regulating drugs is almost like an added benefit. But if that's what's needed to get kind of the regulation of drugs across the line, then yeah, maybe that's just what it'll take.
I feel like we're at this like really embryonic stage where there's research starting to come out now about the use of MDMA, psilocybin in terms of treating stuff like PTSD from former veterans, people who feel suicidal. Have you done much research into this?
Yeah, so I mean, that's not my area of kind of research or interest. I mean, I'm very interested in it, but it's just not something that I've delved too deeply in. But at this conference that I was at last week in Lisbon, where we're hearing from drug policy researchers from all around the world, a huge theme at this conference was kind of the potential benefits of regulating psilocybin and MDMA and these drugs that have potential to have a huge impact on mental health services. And I think it's just because we haven't been able to research these drugs for so long. I think there's a really untapped potential here in what could come out. But I think it's still very early days. I think that was something that was discussed at this conference by kind of leaders in the field. For now, these trials that are ongoing in the US and Europe are still at their early stages, and I don't think we have the sample sizes yet to make big claims about psilocybin treatment and MDMA treatment. But I mean, anecdotally, there's definitely positive results that are coming out, especially linked to PTSD. I think that's been the area that has been kind of the most successful in terms of using these drugs so far. But yeah, it's a really exciting time to kind of to be working in this area.
Yeah, definitely. Ben, there was a question which slipped my head about 10, 15 minutes ago. When we're talking about these overdose prevention centers, I feel like it's almost the birth of creating a virtuous cycle of positivity, of getting people out of a rut. What is do you think there's other infrastructure? What other infrastructure should be perhaps put around to maybe help rebuild this person's life?
Yeah, I mean, the number one thing is housing. I think housing is a huge issue. And I think where you see cities that have problems with drug-related death, there's often huge problems with homelessness and a lack of housing. And there's a really fascinating approach, which is now starting to be implemented in the UK, but is widely used in Scandinavian countries and a few other European countries, but it's called housing first. So in the UK, if you present to the council as being homeless, you get put into a homeless hostel. often you'll have to stay there between anywhere from 1 to 3 months, and you'll be in a hostel with maybe 50 other people, often sharing these big kind of bunk rooms. And over those 1 to 3 months, you have to prove that you can make your meetings and you can kind of abide by all these very paternalistic rules around drug use. And there's all these barriers. So if you're using drugs, often you won't be granted access to these shelters, these sorts of things. And then you'll maybe get into transitional or temporary housing. And then after maybe a year, you'll get your own stable, permanent place to live. And Housing First completely flips that and says, regardless of kind of your drug use or maybe problems with mental health, regardless of that, the foundation to a stable life is having your own home. And so from the outset, they give people their own apartment. And kind of the results from evaluations of these programs have been incredibly successful, showing that people actually, when they get home and they have a stable base, they're then able to progress into job training and employment and reduce their drug use and make their appointments. And so when you ask kind of what is something that needs to go alongside harm reduction and effective harm reduction programs, for me, housing is the number one thing. And people just having the dignity to have a roof over their head, not being treated kind of like cattle and shoved into a room with 50 other people. So yeah, for me, it's housing. If you ask what the number one thing is.
Yeah, I guess that goes back to the earlier points which we're talking about, which was a philosophical question of how we view drug abusers and people who need help. And I guess the worry on my part is if we're asking parties to commit taxpayers' money to funding these kind of programs, I personally think there'll be a big backlash from society. What do you think?
Yeah, and I mean, I think that's what we touched on earlier in terms of it's not a vote winner. I think kind of I mean, all of these programs like Housing First and OPCs and these sorts of programs that show long-term cost savings, there's money that needs to be injected up front. And I think that that's the number one barrier, is that these programs oftentimes they are long-term, necessary long-term solutions, but our political cycle, which operates in 4-year cycles, like governments don't have time to see a program work over 10 years. And so I think that's a real struggle. I think also something that I haven't touched on yet is language. And right. I think that kind of for destigmatization, I think that kind of the decriminalization of drugs is the most important thing, but also just the language that gets used in the media and by governments, even by people like us who are having discussions that will then get listened to. I think referring to people using people-centered language, so people who use drugs or people who are dependent on drugs, people who use drugs, I think it really kind of changes the narrative, as opposed to words like addicts or kind of even something like drug abusers, for example. I think that terms like that really work to kind of enforce this narrative that kind of a moralized narrative that it's someone's fault. And so there have been huge pushes recently to get changes in language, and that's actually been taken up really successfully. So that's good to see.
Yeah, in terms of breaking that stigmatization, I think even something as simple as like what you described earlier, of actually going to these places and meeting these people in person and seeing where they take drugs and actually seeing that their life is falling apart for various other reasons, is probably, I think, the most powerful force in terms of how to flip the perception that people have of these drug users.
Yeah, 100%. And I think also just kind of getting it out there that the majority of drug use in society isn't problematic. It will also kind of help change people's perception on it. Because when you think of someone drinking alcohol, your first thing that comes into your head is maybe someone drinking in a bar or drinking with friends. Like, the thing that we have associated with alcohol isn't immediately problematic alcohol use or someone ruining their lives because of their alcohol use. But when you say to someone, what do you think of when you picture a drug user? Immediately it's someone injecting heroin on the street. And I think that all of these things, kind of the changes in policy and overdose prevention centers, and kind of this more humane way of treating people who use drugs, will help shift this narrative towards kind of a more accepting, kind of public health centered view.
Yeah, it's interesting. With alcohol, we've learned how to regulate it. We put the precise amount of units in a bottle, but generally it's not enough to kill you. We know our limits. We could do the same with drugs, whether it's MDMA, whatever drug it may be. I think there's certainly scope to do that. I'm not sure if there was a study, not a study, there was, I think, an experiment done over a summer at a festival in Bristol called Boomtown. And what they did at this festival, they had these these clinicians come in, and they offered to test your drugs for you to test for potency. And I think there are some really outstanding results where I think they managed to show that like 60% of the MDMA was 5 to 10 times the potency of what is actually safe to take. And these people actually just ended up saying, oh, okay, I don't want to take it anymore. I don't want to harm myself with these lethal drugs, which are being produced in the illicit market because they're not regulated. I think this is a really interesting way to move forward.
Yeah, definitely. I mean, sorry, I should have touched on that earlier. Drug testing is another brilliant form of harm reduction. Because first, I mean, people are then able to identify what's in their drugs and not take it if it's not what they expected. But also what you see is that kind of behavioral changes. People don't want to go out and and people don't want to go out and die, basically.
No.
People don't want to go out or even people don't want to go out and ruin their time at the festival. Everyone's doing drugs at festivals because they want to have an enjoyable time. They want to have fun. And so what you're doing by having drug testing there is acknowledging, okay, most people coming to this festival are going to use drugs. In fact, the only reason that this festival is operating is because it's where people like to take drugs. So just being upfront about that in the first place, I think would be really, really helpful. And then secondly, acknowledging that every single year in the UK, people die at these festivals from completely preventable deaths. It's things that can be completely avoided. If people know what's in their drugs and they can kind of use correct dosages based on the information that they have, it makes everything a lot safer. And I think even just things like kind of having dogs, the sniffer dogs at the front of festivals, those sorts of policies are shown to do absolutely nothing in terms of stopping the amount of drugs go in. And all they do is make it much more dangerous for people, because people are then in the queues, they see the dogs, they take all their drugs at once. And a lot of the drug-related hospitalizations at festivals actually come from this first point of contact with festival authorities when they're just taking all their drugs in one go because they're scared of getting caught. So imagine what could happen if, instead of having that, instead of playing this false game of these dogs actually going to do something in terms of reducing drug use at the festival, you have harm reduction stations in place with trained clinicians. You can test the drugs there. It's just a much more sensible way to approach these sorts of things. And I think it is getting more and more like that. There's an organization called The Loop UK. I think they're the ones who actually did the festival at Boomtown. But they're now starting to go around to festivals every summer in the UK and implement these services.
Is this something that started in the UK, this drug testing at festivals, or has this been happening in other parts of the world?
Yeah, so I know, I don't know the specific history of it, but I know that drug testing in Canada and the US is actually quite advanced, and they've been doing it for a number of years. But again, I'm not 100% sure where that originated. Yeah.
No, oh, it's fascinating. I think it's a great way to take steps forward.
Yeah, I mean, imagine what would happen if you went to a nightclub and you went and ordered a drink, and you were just given a generic drink, and it was either the potency of a full bottle of vodka in there or one shot. Like that's what we're making people do at the moment with drugs. We're saying we have these ways for you to know what's in your drugs, but instead we want you to play complete Russian roulette, and we want you to just go out there and put your life on the line a lot of the times when there are these evidence-based solutions in place. So Yeah, I think it is changing slowly, but it really needs to happen.
Oh, well, thanks for your time today, Ben. Really fascinating conversation. As a final question to wrap it up, what are three fundamental steps that need to happen for us to have an overwhelming change, an overhaul of our current drug policy?
Yeah,
It doesn't
definitely.
have to be three, it could be your top two.
Yeah, okay. So I think first and foremost, um, the decriminalization of all drugs is 100% completely necessary. All that. So what's that saying? What that's saying is that we're going to treat drugs as a public health issue, and the
Mm,
people who use drugs in a problematic way, where it's affecting other areas. Because we mentioned earlier that 97% of drug use is non-problematic.
yeah.
So it'd be the same as someone drinking or smoking, to normal levels. And so what decriminalization is saying is that for the 3% who have problematic drug use, we're then going to be able to, instead of send them to prison and give them a criminal record and completely destroy their chances of regaining stability once they come out, we're going to remove all of that, and we're just going to offer public health services, and we're going to offer them help. So that is the number one thing. I think that will also go to massively help in terms of racial disparities in prisons and kind of all this money that is lost in the criminal justice system that could be saved for non-violent drug offences. So okay, so that's the first one. The second is the regulation of drugs as well. I mean, if you look at Portugal, they've decriminalized drugs, but they haven't regulated drugs, and so you still have people going to the black market who are getting drugs and they don't know what it is. And what you do with regulation is you say that for people who have problematic drug use, they can then go to their pharmacist or their GP. They can get access to these drugs and can then work with a GP, having safe amounts of these drugs where they aren't going to overdose and die. And then they can work with a healthcare practitioner to reduce that intake over time. And I mean, there's different models of regulation. There's an organization called Transform Drug Policy, who are based in Bristol, and they've actually written guides on how to regulate cannabis, how to regulate stimulants, and then they recently came out with a kind of a bigger volume which looks at how to just have a regulated drug market, and they consult with governments all over the world who are looking to implement these policies. So I'm not an expert on regulation whatsoever, but there are blueprints for doing these things, which would kind of completely mitigate the chance of overdosing and dying, because all these overdoses are linked to potency and not knowing how strong the drugs are. And it also would just take all this power and money away from criminal gangs. I mean, that's something that I haven't touched on at all today, but if you trace back kind of from the consumer down to the production of drugs, the majority of the violence that's caused from the drug trade is in producing countries and countries through which the drug trade moves through. And so, I mean, that it's another kind of moral and ethical conundrum for Western governments who have all this data around kind of murder rates and kind of the damage at the societal level that's being caused in kind of Southern American countries and African countries because of the drug trade. And so by regulating drugs, you're taking this money and this power and this violence away from the black market, and you're just making it safer for everyone involved. So decriminalization, regulation, and then huge investments into non-judgmental, non-coercive drug treatment for people who need it. So not forcing people into drug treatment, but having it there available for people who need it and who are ready to go into drug services. So yeah, those would be the three things: decriminalization, regulation, and investment in drug treatment services.
Oh, that's fantastic. That's a great summary. It's a great way to end it, Ben. Thank you for coming on today. You're clearly very well versed in this area of harm reduction and challenging the status quo. And I have big respect for you because you're going against the grain. I think, unfortunately, most of society doesn't think the same way as you think when it comes to drug policy. And I hope in a couple of decades, we'll come around to that once all the evidence becomes too overwhelming. Yeah. Are there any other links that you want us to point towards? I'm going to leave a link in the description below to your TEDx talk, which is excellent. I recommend anyone listening to go straight to that TEDx talk, after listening to this podcast. Are there any other links that you'd recommend?
Yeah, I mean, there's a few organizations that provide really, really interesting information around harm reduction for those who are interested. So Harm Reduction International, if you just Google Harm Reduction International, they've got a ton of resources about what are these different forms of harm reduction and where they're being implemented, what are the global trends. If you're interested in kind of the regulation of drugs, Transform Drug Policy Foundation, they've got a brilliant website with all of these kind of freely accessible kind of manuals and just information about what regulation would look like. And then the final one is an organization called VaultFast, and they post kind of op-eds and blogs to do with the politics of drug policy in the UK. And they lobby government and they kind of post stuff all the time. So they're a really, really interesting organization to follow. So yeah, those would be my three to check out.